health system. My co-host is unable to attend today, so Chris Rooney is not going to be joining us. Joining us today is Krista Hoglund, who will be speaking about insurance pricing basics and a look at how COVID-19 is impacting pricing currently. Krista is the Chief Actuary and Financial Officer at Security Health Plan. She's been in that role for 2 years and with Security Health Plan for 13. She's a Wisconsin native. She graduated with a degree in applied mathematics from UW-Stout, has 2 teenage children and loves to travel, and has over 15 years actuarial experience. So with that, I will turn it over to you, Krista, and welcome.
Thank you, Jeff. I'm excited to be here today, and hopefully I can share some information that you all find valuable in trying to give a little bit of basic information to help you understand what are kind of the key drivers around insurance premium, and then specifically kind of what we're seeing as potential impacts of COVID as we look at pricing for 2021 and beyond. So let me get my slides going here. All right, so I wanted to start with a visual here of the insurance premium dollar. And this is how Security Health Plan spends the premiums that we collect from insurers. And this is a backward look. So this is looking at the last couple of years, and it's across all of our business. So it's not specific to commercial group. It really incorporates, Medicare, Medicaid, individual, as well as our group business, with each product actually looking a little bit different on their own. But this is how it looks when we aggregate all that business together. 90 cents of every dollar that we collect actually goes to pay for healthcare. So that's your hospital services, your prescription drugs, your surgeries, or your office visits. So that's the bulk of those dollars. 8 cents of the dollar is to cover administrative expenses. So that's for things like customer service and claims and kind of all those other functions that we need to provide service to all of our clients. And then that final little tiny sliver at the end of 2 cents, that's the profit that we retain to keep our business going. So again, I just want to reiterate, this is specific to Security Health Plan, and this dollar isn't going to look the same if you're looking at a different regional insurer or if you're looking at a national insurer. In particular, the administrative expenses for us, because we're not for profit, are going to be lower. We're not paying taxes, but a profit, a for-profit or publicly traded company is going to have a little bit more administrative costs that they have to cover. And then similarly on the profit side, if you're publicly traded, you're going to have more than 2 cents on every dollar in terms of profit to make sure that your stockholders stay happy. So Jeff, I may not be able to influence the stock market, but there's my little nod to the impact of stocks that in our discussion today.
Excellent.
So then moving forward to kind of change the view. So that previous slide was backward looking, but now this slide is more forward looking. And instead of how we spend the dollar, how do we develop that premium number? But the pieces are really similar, right? It's kind of broken apart in a similar way to that dollar bill with claims, admin, and margin. But I have that arrow kind of pointing down at the projected claims piece because that's going to be the driver of your overall premium. It's a huge percentage of the total. And so that's where we're going to spend a little bit more time of our discussion today. So projected claims. Here's a simplified formula of how we get there, but I'm going to walk through the different pieces in a little bit more detail. So I'm going to start with the historical claims. That it's also sometimes referred to as experience period if you're speaking in insurance speak. And this can mean something different depending upon the size of the group that you are part of. So if you're a larger size, large group, this is actually specific to you. It's your actual group's experience for you on your own, all by yourself. So that's really kind of conceptually the easiest one. If you're a mid-sized large group, typically your experience is blended. It's a combination of your own actual experience, but it's what we call pooled with the larger block of business. And the reason for that is because a smaller size group is going to have more volatility year to year. You just don't have as many people to spread that risk over. And so to prevent kind of big swings from year to year in your projected claims and therefore your premium, it just makes sense to use that more stable kind of population, broader population as a balance to keep things sort of less variable year to year. And then the final kind of group is if you're a small group. There are some specific regulatory requirements around how small groups have to be rated. And in particular, coming out of ACA, it's got to be the entire block of business. We can't use an individual small group's experience to rate that individual small group. So again, experience period means something different, and it's important to know kind of which category that you fall into. The next section, that next little circle is trend. And trend is intended to take us from kind of what happened in the past to what we think is going to happen in the future. And trend has to account for a whole bunch of different factors. So I'm going to kind of talk you through what some of those factors are. The first couple are probably the easiest and maybe most obvious, but being trend and cost, or utilization, and cost. So how many services you think a group of people is going to utilize in the future period? Is it going to be, are there going to be more surgeries or less surgeries? Are there going to be more office visits or less? How about pharmacy utilization? So that's one piece. Is there going to be the same, more or less in terms of the number of services? Then you have the cost component. So that can also be thought of sort of as inflation. How much is the cost of care to provide, the same care year over year changing? And that relates back a lot of times to what providers are charging, or their charge masters, or how those contracts with providers are really shaking out. So that's a big driver of trend. But in addition to that, there's also things like new advancements in technology. So think about some of the gene therapy options that are now available. Those have to be incorporated to the extent that you think that they could impact the population that you're covering. New drugs, the pipeline of new drugs, and high cost drugs in particular is an important component that also has to be considered. In addition, regulatory changes. So I think this is one that can get missed if you're not really kind of thinking about all the factors. Coverage mandates is a great example of regulatory changes that can have an impact. So, a few years ago with ACA, what was required to be covered by groups really expanded. And so trend needed to account for that. Within the state of Wisconsin, a few years ago, there was an autism mandate that required some additional coverage around people with an autism diagnosis. So those are some great examples of coverage mandates that have to be considered as part of trend. And then in addition to that, you've got, kind of general other market changes. And this could be things like, adding a provider to your network or dropping a provider, adding, a new geography to your network, those sorts of things that all kind of have to be thought about as you're thinking about how might those claims look different in a future period. So, kind of to encapsulate it all, trend is both qualitative and quantitative. You have to think about a lot of different pieces, and I'll wrap them into that one number. And that gets you to your projected claims. But I know that was not very concrete. And so I'd like to give you a little bit of a concrete example to kind of bring it home. So this example is assuming somebody that has a July renewal or a July kind of start date for their coverage. And this is a great example because right now, typically, if you're a July group, you're thinking about changes right now. You're thinking about what you want to do for next July, and you're working through those pricing pieces right now. So typically, your experience period is going to be calendar year 2020. It's going to be that prior calendar year. Or potentially it's a 2-year period, so maybe it's 2019 and 2020. And in this example that I'm saying that's $1 million, that little orange box there on the bottom. And then you have trend. 6% annual trend is a fairly common sort of industry standard number when we look at what's kind of going on within the market. So I picked that for this example. And it's actually for 18 months. And so this might be something that's not kind of immediately obvious to people. Why is it 18 months? Well, if we were going from taking 2020 claims and using that to price 2021, that would be 12 months because it's 1 year to another. But we've shifted that over 6 months for that July start date. And so then we need that 18 months instead of 12 months. And so that you see that formula with that 18 over 12 power. And then finally, that gets us to the projected claims, which is just under $1.1 million. So this example is talking about a typical year, right? And we all know 2020 was not a typical year. And so we have to think about how do we need to think about trend differently because of what happened in 2020, and in particular, what impact did COVID have on that trend number? So I really liked this visual, and I thought it was kind of helpful for you to immediately see what kind of happened in March, April, and May. But first, let me just orient you to the graph slightly. It shows 2018, 2019, and 2020 actual experience. The claims are being shown in per member per month amounts. So that's why the dollars might seem smaller than what you might otherwise think. And it's very clear from this graph that something unusual happened in March, April, and May, with that dark blue 2020 line having a gap below kind of what 2018 and 2019 more normally would have you would have expected. So that draws our attention right there immediately to something's going on here that we have to think about differently. But I also want to draw your attention on this graph to June through December, because what we saw in June through December is that dark blue line started to be much more in alignment with the 2018 and 2019. So while we had a disruption, there appears to be a kind of a return to a historical normal towards the end of the year. And that can give us a hint about what we might be able to expect in 2021 and beyond in terms of what claims might look like. So as a health insurer, you can look at that previous data on the slide and start to think about, okay, what can I do to account for that period of time that looks very different from the rest of what I would see historically. And I'm going to highlight a couple of different possible approaches that an insurer could take based on looking at that line. So the table on the left-hand side that I'm showing is kind of what was expected before COVID, before the impact of COVID. Going into 2020, if you expected, 5% trend per year for the next 3 years, and then what do your claims look like? So you see them incrementing by that 5% to get to your expected claims over the next couple of years. But again, reality didn't look like that, right? 2020 didn't actually look like that. And so, how might that change how we think about 2021 and 2022 claims? Or does it? Does 2020 being different actually impact what we expect for claims in the next couple of years? So here's a couple of scenarios to think about. So scenario A, and I'm titling this as the pay now scenario. So this is one way an insurer could think about this. They could say, well, 2020 was a complete outlier. I can't use that information. There's nothing for me to learn from it. I'm just going to sort of set it aside. Or they might say, I'm going to trend across 2021 and maybe use 2020 and use 2019 data instead. So if they're doing that, what you likely could see is a big trend increase in 2021. So that's showing up on this graphic as a 1.1 compared to the 1.05 that we saw, kind of as what we had originally expected. What that does is it gets your claims estimate right in alignment with what you expected before. So that's what this column's telling you. It's saying I just made a large trend adjustment, essentially doubling trend, to get me back to where I originally expected those claims to be. And then following that, I'm going to go back to my more of a standard trend. So this is one, as I said, one approach that an insurer could do. Another approach, which I'm kind of categorizing as the pay later, is you could set aside 2020 and say, well, I know it was an odd year, but that doesn't mean I can, sort of completely dismiss what happened. This could be a new starting point for trend, kind of a starting over, and perhaps it's more reasonable to trend off of that number, using the same trend that I had originally thought was reasonable. So this might seem like it's appealing as a group to say, well, yeah, I'd love for you to use a lower trend. But this one, I think where we have to be a little bit cautious or think a little bit further is as we think about future years. So what if 2021 and 2022 do return to what we originally expected? If that happens, our claims projections are way too low, which means our premium's too low, and eventually we're going to have to recover. So that might be 2022, it might be 2023. And so I just brought in 2023 and I said, yikes, you're not going to like the trend that you might see on your 2023 renewal if the actual claims come in more in alignment with what was historically projected. And who knows what other expenses might be competing for your dollars at that point in time. So this sort of pay later delayed approach it also could be something that insurers do, but there's a little bit more risk, both from a group, I would say, and from the insurer's perspective in doing this. So that brings us to scenario C, which is my favorite of the scenarios because it takes sort of that moderate view between the two scenarios that I kind of already described. It looks at this more as a multi-year approach. And so it a lot starts to align over 2 or 3 years with what your historical expectation was. So, in 2021, I'm not getting all the way back up to that 110, but I've recognized that there's probably claims are probably going to be a bit higher than just trending that 5% off of 2020. So what I really like about this scenario is it acknowledges that there is uncertainty in 2020, 2021 and out into 2022, and that these claims that we expected, before the impact of COVID might not be they might be, but they might not be the right numbers. And taking more of a long-term approach allows you to adjust each year as you see that actual experience come in. So I know there was a lot there. Jeff, I'm going to pause just for a minute in case there are any questions coming in.
That was a good place to pause, Krista, because there have been questions coming in. So if you don't mind my tossing some at you here, let's see. One is, in your scenarios, aren't you ignoring the fact that everyone received a trend increase in 2020, thus leaving them at a flat isn't making sense?
So I understand the point that's being raised, that's sort of that backward looking, again, 2020 didn't happen as expected. But I think what I'm trying to highlight is 2020 as an anomaly doesn't necessarily change the expected claims for 2021. We see this actually pretty frequently happen as we look across time on blocks of business where you have a year where you have low trend, and then you have a year following it where you have high trend, and over time it normalizes to this kind of wonderful trend line. So I think that the point being raised is 2020 was an anomaly, and if you plotted it on a graph, it would be kind of a low point. but you can't assume that that low point is what you should be trending off of either. So again, I think this is just, think about the different scenarios. Think about if claims are coming in 2021 at that $110 and you didn't take any trend, then you're going to be getting that yikes in a future year, because eventually claims and premium have to be aligned with each other.
Okay, a couple more questions. Will the recent legislation that passed at end of 2020 that affects insurers affect trend going forward?
So I'm not sure specifically which kind of piece of the legislation. I know there were some things on transparency and data and information sharing. I wouldn't expect those to have an impact. There are some things around coverage for COVID in particular that have to be thought about. However, right now, a lot of those pieces are being picked up by the federal government. So for example, COVID vaccines in 2021, that's actually not being covered by insurers. It's being covered by the federal government. And so there didn't need to be an adjustment for that.
Okay, thank you, Krista. Just a reminder, you can enter your questions in the chat box and we'll ask them either later, or if we need to pause again, we can always pause. So back to you, Krista.
Okay. So I am gonna switch gears a little bit here for the next slide. And hopefully maybe do a little bit of myth busting for those of you in the audience. So I'm gonna pull in some headlines from 2020. And these started to appear the middle of the year, kind of after the second quarter insurance results became public knowledge. And these were around the profits, the kind of record profits that health plans were experiencing because of that low utilization of services that we saw in that March, April, May timeframe. So this was kind of a big discussion point for that July, August timeframe. So what happened? Well, we did see insurance providers kind of across the nation respond in a very positive way with expansion of benefits, temporary expansion of benefits in some cases, cost share waiving, refunds, and that sort of thing, which sort of spurred another set of headlines talking about kind of all of those coverage enhancements or premium refunds that were being provided back to individuals and groups. And then, of course, one of them being the headline related to what Security Health Plan did. So just pulling that out to remind everybody, insurers did respond by providing some things back to their customers. And I want to leave you with this on this slide because I think it's really important. Most health insurers did end the year better than what they would have expected. That's absolutely true. Not all, but many. However, commercial group business was not the line of business that generated these record profits. Going back to that experience that I showed you, where June through December, that utilization really did kind of return to a historical level. That wasn't the case on some of the other lines of business. So, individual and Medicare and Medicaid tended to be the lines of business that really generated that overall health plan profit across the nation. In particular, I know from having conversations with other regional healthcare organizations that really was consistent, where it wasn't commercial group that was really driving these profits. So I just want to make sure that there's not that persistent myth out there that you as sort of local community businesses really padded insurers' margin. That certainly wasn't the case for Security Health Plan, and generally wasn't the case across the industry. So why is that previous point important? I think it's actually really important because When we talk about what's up here on this slide in terms of what Security Health Plan and Marshfield Clinic Health System did in response to COVID, it was not because of a financial or regulatory requirement. It was because of our mission and because of our commitment to the communities that we serve. And I can honestly tell you, and I would tell anyone, one of the most satisfying days of my career, my entire career, but in particular my career here, was the day that we made the decision to provide the premium refunds to our groups. We truly wanted to put that money back into the community at a time when we felt like it was needed. And then subsequently to waive that cost sharing for our members on our individual products as well as our Medicare Advantage products. Because again, we know people were running into financial issues related to work, being laid off, that sort of thing. And again, didn't want those financial barriers to get in the way of people getting the care that they really needed. So you may think, yeah, sure, she's the CFO. She was probably out there arguing against this the whole time. And I'll tell you, absolutely not. I was one of the people pushing this forward because I truly believed that it was the right thing to do for our groups, for our communities, and for our members. So finally, as we pause for questions, again, I just want to leave you with a Security Health Plan mission statement, because I will say this is truly how we approach healthcare.
Thank you, Krista. More questions have come in, and we're coming up at the end of our time here. So I'm going to do my best to toss these out here and hopefully get them answered. How are you addressing dollars in care and the possibility of more severe medical conditions in your trend factor to address the impact of COVID?
Yeah, so that certainly is a topic of discussion, and so I'll maybe just broaden my response a little bit beyond that specific question, because there are two sides to the COVID impact that we have to be thinking about for trend. One is exactly kind of what you're getting at in that question. There's also pent-up demand. People didn't get all the care they needed in 2020. We absolutely know that's a fact. And so is there going to be a lot of additional services that people need in 2021 because they couldn't get it in 2020. They ran out of time. There's also a potential cost from delayed care. So people that have those chronic conditions that didn't get care, or perhaps they didn't get their preventive screening and there's a delay in diagnosis, that could impact and increase care. But then there's the other side, right? There could be, a new strain of COVID that sort of continues to restrain what people feel comfortable getting for services. We could see a continuation of what we thought was a really positive trend, which is less ER utilization and maybe more appropriate ER utilization during COVID. So we're thinking about all of these pieces. But generally speaking, as Security Health Plan is looking into 2021, we're not making a massive trend adjustment to account, because we think that these factors are potentially going to wash each other out. We're just not comfortable saying, oh, costs are going to be way higher because people are going to be doing one thing or another thing going forward.
Thanks, Krista. I think we have time for one more question, and it sort of dovetails on what you just said. How much of an increase do you think premiums will go up for 2022?
Oh, wow. Somebody's really asking me to take out the magic 8 ball on that.
Crystal ball question.
Yeah, and I would say if I knew that, I'd be making a lot more money somewhere else, probably. But I would say I'd like to think that by 2022, things will have settled down and will be more kind of back in line with a historical average kind of experience. It's really, really hard to say right now, and I think that's what makes it so difficult, because we're starting to think in some lines of business about how we're going to price for 2022. All I can say is, here we're continuing to work on what are our opportunities to lower the cost of care. what can we do to try to offset anything that might be coming down the road in terms of trend. And so there's that constant sort of pursuit of the next idea. We continue to expand on, that hospital at home concept and lots of our geographies. Again, just thinking about, telehealth, how can we provide care in a less costly way, so that ultimately what we're asking our groups and individuals to pay can be less.
Thank you. And I see we're at time. So Krista Hoglund, thank you so much for your presentation. We had a very engaged group of viewers. So I would imagine we'll be having you back in the not too distant future, I'm guessing. Just a reminder to those that are watching, the topics and subject matter come from you. So when you send us questions or you send us ideas, we follow up with subject matter experts and have them on the program. So thanks everyone for your time. Thanks for your engagement, and we'll see you next time.